So many people using chatbots, AI companies have started redesigning them to answer health-related questions. Oh, that doesn't sound dangerous at all. Our medical expert, Dr. Payal Kohli, is here to talk a little bit about that and the data and health questions and conditions. This can't be all bad, but I know how y'all feel about Dr. Google.
No, it's funny because a lot of us in the medical industry think of this as a health partner.
Okay.
But when you look at the data, it's the types of questions that you ask that you should be really careful for. So there was a great study just came out in Nature Medicine. It took 60 hypothetical patient examples, ranging all the way from mild illness to very severe disease. And it had doctors say how they should be managed. And then it compared that to what the chatbot said. In more than half the cases, when the patient should have been sent to the hospital because it was a life-threatening emergency, it said, stay home, call your doctor's office tomorrow.
Oh, that's scary.
So that scared us.
That
scared us a little bit. Yeah.
I think like everything, I mean, when I started using AI, you ask it questions, you don't take everything it says, as gospel. It's like with a grain of salt, but it can help you start in the right direction, right?
But here's the problem with that, Phil. It's what you put in is what you get out. So let's say you put in there that, I'm having a little bit of a headache, but you forget to mention that your face is drooping on one side.
Right.
It's going to say, okay, if the headache is mild, you have no visual symptoms, go ahead and stay home. So that's one of the big challenges is that it doesn't have medical context. It doesn't know your medical history, it doesn't know your blood tests, your imaging. It just kind of takes what you put in. It can't examine you. So in medical school, we used to call this the eyeball test. Sometimes you walk into the patient's room and from the door, you can tell if they're in the midst of an emergency or not, just on how they look, whether they move normally, whether any kind of movement stimulates abdominal pain, whether or not they're having a crisis. So that's really important as well. And then what it does is it tries to make patterns. So it actually does something called hallucinations because it tries to complete patterns. And it happens a lot more commonly than you think.
So it's looking for something?
No, it's
trying to
making
complete?
up stuff. It's completing.
It's trying to making up stuff to complete.
Yes, it's predictive. So let me give you an example. So the sky can be blue, the sky can be black, and the sky can be sort of orange or pink at sunrise or sunset. So the AI chatbot will say, well, these are all colors, and these are all descriptions of the sky. So let me now say the sky can be purple. And it presents it to you as a fact. And unless you know that that's not a fact, to challenge it, and sometimes I've done that, I say, no, that's not true. Then it corrects it and comes back. But unless people are challenging these confabulations or hallucinations, as they're called, these large language learning models are designed to complete patterns. And so it starts to put things together that aren't necessarily true. And you can imagine with medicine and with law, that can be really tricky.
So I look at it from two ways here. For people that are scared of doctors, this is an easy out to say, well, I'm just checking it on ChatGPT. And then the hypochondriac is like, oh my goodness. So it's not good either way.
So I would say it's the types of questions you ask. So for example, when I tell my patient, go home and have a heart healthy diet or a low potassium diet, great. Ask ChatGPT what that means, because that's an informative, factual type of question. If you tell the patient, if you put in your symptoms and your blood tests and say, okay, give me a diagnosis, no, absolutely not. That's where your doctor comes in. So you want to try to get medical information from ChatGPT. You sometimes can say, okay, help me interpret this blood test so I know what to ask my doctor.
Or what is this on the blood test? Sometimes there's a word I don't even know what it means.
HCT, that's the hematocrit, that's the
Yes.
concentration of
Okay.
red blood cells. So factual information works great. It works great as a medical communicator and a scribe. So some of my patients bring in ChatGPT to listen during our visit.
Smart.
And I do that also as a physician. We have our kind of medical versions where it can then generate patient-friendly language and instructions based on what it heard. So it's a really good scribe, communicator, note taker. So these are all great ways to use ChatGPT, but don't adjust your medicines. Don't decide on your symptoms based on ChatGPT.
I just got to get this last question in before we go. I've talked to so many people in their industries, and they're all worried that AI is going to replace them. And I know I will never, I'm always want to go to a doctor, so I preface this question with that, but are there people in your profession that are concerned that someday?
Very terrified. I'm not. I think it's going to make me better. But I think there's, in fact, a law being passed in New York where they're going to make it illegal to have medical or legal chatbots. And you can sue somebody who does that. So there's a lot of pushback. I think it needs a little regulation because I don't think anyone's watching. And so it's running amok. But I think if you do it right, it can be tremendous. It'll make me better.
Okay.
I want to see you.
Yeah.
Thank you.
I like the human interaction in most things.
I know it. Thanks, Dr. Kohli.